Hello everyone, my name is Bessy Lovos. Me and along with my team members Maria and Vineela will be presenting on our project of assessing impact of artificial intelligence on patients with major depressive disorder. This was part of our course Workshop in Health Informatics taught by our professor, Dr. Farrokh Alemi. This project is one part of a whole AI system project that is addressing the needs of patients with major depressive disorder. The AI system we are assessing firstly takes a medical history intake and recommends antidepressant treatment for patients with MDD. Our project particularly focuses on the follow-up care for these patients. This project is significant as follow-up care for patients taking antidepressants is essential for optimizing treatment outcomes in MDD. This condition is projected by the World Health Organization to become the leading global disease burden by 2030. Effective antidepressant selection is complicated by genetic, psychosocial, and biological differences, emphasizing the need for equitable mental health care. Regular follow-ups using tools like the Patient Health Questionnaire 9, which is a validated tool consisting of 9 questions that measures the severity of depressive symptoms, helps provide clinicians with a standardized method to track changes in patients' mental health over time. The results of this PHQ-9 help and measure the patient's depression-free days. This represents the number of days a patient experiences minimal or no depressive symptoms, allowing clinicians to evaluate the long-term success of treatment. These approaches facilitate personalized care, they help address health disparities, and enhance therapeutic decisions. Ultimately, our goal is to examine the effectiveness of antidepressants in MDD patients in the follow-up care phase. Moving on to the methods, this project is a retrospective analysis examining the results from PHQ-9 surveys and depression-free days, and this is a metric that is used to assess the effectiveness of depression. Our sample size consists of 10 patients diagnosed with MDD, and these patients were followed for 4 months, and we collected 40 responses. Our main data collection tool was Google Forms, in which we administered a PHQ-9 survey for depressive symptom tracking once every month for 4 months. Zapier was used to schedule and distribute the reminder emails at the beginning of every month. The depression-free days were calculated using the scores from the PHQ-9 surveys. After the study was conducted, we then used Google Looker Studio to visualize the results for all 10 patients over the follow-up time period to observe any trends.
Hello, my name is Vineela Ramineni. Now I'm going to continue with the rest of the presentation. On top of the data collection process, patient confidentiality was also a top priority. And in our study, all patient information is securely stored and encrypted to maintain confidentiality. And also, our studies adhere to HIPAA compliance standards. Before patient even takes the survey, the patient were supposed to agree to the consent form, and in this consent form the patients are briefed about the purpose, procedures, and data usage before any participation. And the participation in this study is purely voluntary. If the patient is not comfortable, they can withdraw from this study at any period throughout the duration of the study. And after patient is done with filling out the survey form, the PHQ-9 survey form, the pH after that, it's going to redirect you to another survey where it collects the payment information, and in this it collects the participant's name and also payment details very securely, and so that we could ensure that responses to the depression survey remain anonymous and unlinked to the payment information. And for the data collection process, we use the web-based automation software called Zapier to send out automated emails to patients every month for a 4-month period. And this email contains links and instructions to finish the survey. So if the patient fails to submit this survey within 1 week of receiving it, Zapier will automatically send out a secondary reminder follow-up email. And if the patient still didn't finish the survey, then the issue will be escalated to higher authorities so that they can follow up with the patient directly through a call. And the PHQ-9 scoring was used to assess the depression symptoms for patients. For instance, each question has a score of 0 to 3, and then the total score will be added at the end. and that score is used to assess the severity of the depression symptoms in patients. For instance, if the patient PHQ-9 score is like less than 10, then that represents a moderate depression. If the patient depression score PHQ-9 score is greater than 20, then that represents severe depression and patient needs help and as fast as it can get. And the depression free days score is used to evaluate the effectiveness of treatments in patients across a 4 month period. And this represents the number of days patients have not been experiencing depression like symptoms. For instance, higher depression free days indicate that a greater period during which patient was free from significant depression symptoms, suggesting that there is an improvement in their condition. And this is a formula used to calculate the depression free days. And this number is used to track the progress and also severity of the depression symptoms amongst the patients. As you can see, this is a preview of how our survey looks like in Google Forms. So first we collect the patient information, like patient email, and then the month patient is responding for, and then the scores for each PHQ-9 question. And after finishing the PHQ-9 survey, it will redirect you to a thank you page where there is a link for payment information collection. And this page collects the patient full name and email address for payment notification. And both the responses are stored separately, which helps us to make sure the patient information is anonymous and confidential. These are the DFT scores of each patient across the 4 month period. Across the entire cohort, the average DFT score was around 57, meaning most patients experienced moderate relief from symptoms. From our analysis, two patients stood out the most. As you can see, the patient 10 showed a significant improvement with a DFT score of 93.4, indicating a substantial reduction in depression symptoms over a study period. However, on the other hand, patient Fry demonstrated a minimal improvement with a DFT score of 6.6, highlighting that there is almost no improvement in their treatment response. This analysis highlights the variability in treatment effectiveness and also emphasizes the need for personalized interventions to improve the patient care outcomes for all patients. We used Google Looker Studio to visualize the progress of 10 patients across the 4 month period, with each graph representing a progress of each patient. As you can see from the graphs, most of the patients have a positive linear trend, showing that patient conditions are improving over time. And this dashboard not only helps us to track the patient progress, but also provides a holistic overview of the study, offering valuable insights into patient progress and also treatment effectiveness.
This study highlights several key findings and considerations regarding the follow-up care of patients with major depressive disorder who are on antidepressant treatment. Our findings emphasize the importance of personalized treatment plans. While most patients showed gradual improvements in their depressive symptoms, individual responses varied significantly. For example, patient 10 experienced significant improvement with the depression-free days score of 93.4, while patient 5 showed minimal progress with just a score of 6.6. This variability underscores the need for clinicians to adopt individualized approaches that address unique patient factors. The use of automated tools like Zapier and Google Forms enable scalable follow-ups and ensure consistency in data collection. However, these tools lack the nuanced human touch necessary for addressing unique challenges faced by individual patients. Literature suggests that combining automation with human-driven interventions, such as care managers, could improve outcomes. The small sample size of 10 patients limits the generalizability of our results. Homogeneity in participant demographics restricts our ability to explore the impact of factors like age, gender, or socioeconomic background. The 4 month follow-up period may not be sufficient to capture long-term trends or the full impact of antidepressant treatment. Self-reported data like PHQ-9 scores introduce potential biases such as inaccurate reporting or subjective interpretations. These points highlight both the strengths and limitations of our approach, providing a foundation for refining future studies and mental health intervention. In conclusion, our study provides several valuable insights into the effectiveness of antidepressant treatments for patients with MDD. The average DFT score of 57 indicates modest improvement across participants. However, variability in outcomes points to the complexity of treating depression and the need for more personalized approaches. Expanding the sample size and including more diverse demographics will enhance the reliability and applicability of findings. Extending the follow-up period beyond 4 months will allow us to observe long-term treatment effects and sustainability of remission. Integrating automated tools with human interventions can balance scalability with the individualized care that patients need. Policymakers should support initiatives promoting personalized medicine in mental health care, including pharmacogenomic testing. Hybrid intervention models that combine technology with collaborative care teams should be encouraged to improve treatment outcomes. Ultimately, this research underscores the importance of equitable and personalized care in addressing mental health challenges. By improving follow-up strategies and tailoring treatments, we can better support patients in their journey towards recovery. These are our reference articles. Thank you for your time.